Hi, I'm Donna Wilson, high-risk breast nurse navigator at Henrico Doctors Hospital. What I do is I meet with patients if they're available when they come get their mammogram, or sometimes I'll give them a call or send them a letter, and I explain to them what it means to be in an elevated risk for breast cancer. We do screening for patients when they come in. We get their personal history, their family history. What we've done in the last 3 years, we've been a pilot program here at Henrico Doctors Hospital with Sarah Cannon, and we're formalizing the process. I came on about a year ago, and what I'm doing is I am the person that's actually looking at the charts and identifying and collaborating with the PCPs and the GYNs and our high-risk providers, which is our breast surgeons, and getting those patients to them. Also, additionally, we have a genetic counselor on site here. So if the patient meets NCCN guidelines to have a family history that puts them at an elevated risk for breast cancer or gynecological cancer or colon cancer, then I can get that patient in to have a conversation with our geneticist. So my role as a high-risk breast nurse navigator is to, number one, be an advocate for the patient. I see my role to be there to explain and educate the patient about what does it mean to be at an elevated risk for cancer. A lot of what I do as a navigator is I use my clinical skills of being a nurse, and I explain to them what they can do to take their personal part in their health journey. So I educate the patient about breast density, I educate the patient about the importance of mammograms, I talk to them about and coach them of what they can do to ask their providers different questions. We have written information for the patient to help them understand about their breast health. Really, my role as a nurse navigator is to be there as a coach and as an advocate for the patient. And then also, the flip side of it is I'm very much collaborating and communicating with the patients. Part of my role is to let our referring providers know that I've talked to their patient, that their patient is going to have questions about a breast MRI, the patient is going to have questions about the timing of their mammograms. So I'm there and I'm collaborating with the physicians and letting them know. It's beneficial to the patient because early detection is the best prevention for any type of cancer, and mammogram is the gold standard for detecting breast cancer. Those patients who score higher or identified as being at high risk for breast cancer need to have additional imaging. Here at Sarah Cannon HCA Henrico Doctors Hospital, we follow the American Cancer Society guidelines, and those guidelines state that anybody that's at an elevated risk for breast cancer should have a mammogram yearly, absolutely, gold standard, continue to do that, but also they should have a breast MRI. And the breast MRI and the mammogram are usually 6 months apart. When the patients come here to our site, they're not just getting what we think. The patients that come to Henrico Doctors Hospital are part of a larger network within Sarah Cannon and the HCA. So those patients are benefiting from having the research-based care. Our providers here are meeting with other pilot sites across the HCA system nationwide to look at best practices that can provide a really good outcome for our patients. And we're working together to look at how can we best provide this service to our patients that will identify them and empower them to know what they can do for their health.